Who let Mitch put up the posters?
No one did. That was my
just
choice.
secretly come in at night and switch them out.
So we got a little Keeper's Heart whiskey,
I'll be the center of this
Irish
clink.
whiskey. So here's the tap.
Dear girl, I am a doctor. Doctor.
These go to 11.
Wait a minute, Doc. Are you telling me that you built a time machine?
Did we just become best friends?
Yep!
The skeleton ran out of shampoo in the shower.
1.21 gigawatts! This is a house of learned doctors. You're not a doctor.
All right. Well, episode 6 of Spinal Tap with myself, Dr. Zach Mashinsky, to the right of me, viewing left, Dr. Mitchell Evenson.
Thank you.
And then we have Richie too. He's
I'm
here,
here.
I guess.
I'm always here.
He's in the corner.
Hello.
And then we got our good friend, Mr. Tyler Kleinhausen.
Hey, good job
So-
on that one.
Yeah, pretty good, right?
Yeah.
I practiced all
That's
night.
great.
Stayed up all night just practicing.
That's creepy.
Spelled it out. Say it in a sentence.
Yeah.
So we're gonna talk about kind of all things, more training, rehab. Tyler is our rehab professional that we refer a lot of our patients to. He does great work, and we trust him more than anybody.
So, patient told me about you. I'm just assuming that's what it was. And I personally was dealing with some knee pain. Recall that? I came out, I was like, someone said you're good at this. Let's take a look. And darn tootin', you shifted all my knee pain into my foot in like 2 sessions. So we gotta handle this a little bit beyond that.
Let's
But
do it.
my first meeting, I reminisced Tyler being very intelligent about the body itself, just the functionality. And you made a good point where, like, maybe you should say it. How do you view us chiropractors versus you? The power line analogy. Let's hear it from the source.
Okay.
And
So
that-
you
that
remember
was-
way back. Okay, that's good. Good. Well, yeah. So, I mean, I'm working with people in movement-based rehabilitation, focusing on the nervous system, right? You guys, chiropractors, everything's about the nervous system, but almost from more of that neurostructural side. So the way that if I have somebody that comes into me, a lot of times they're already seeing a chiropractor, or if they're not, I'm going to say, hey, go do this, because the analogy that I probably used that you liked was thinking about like a cell phone tower, right? So if there's a big storm and there's some sort of damage to this big vertical tower, the job of the chiropractor is definitely straightening that thing out, right? But there's still going to be vulnerability if all of the cables that tether that tower in all the different directions aren't back up to the proper tension, the proper length, and the proper slack, right? So we need to have that balance of both things. You don't want to have a crooked tower. That's not going to work properly, and you don't want to have a lack of support. So both of those things need to work together, and my job is adjusting the support, essentially.
Like that.
Yeah. And the company that you work for, Evo Performance.
So Evo Performance Rehab. We are kind of an accelerated alternative to the conventional physical therapy system. We want to be outside of that. We want to be able to work with somebody from, I just had a traumatic issue. I have a muscle tear. I have a joint replacement surgery, whatever it is, all the way to the point of I feel like I'm slightly inefficient. I'll get a hockey player who's very experienced, but they're not quite as fast as they need to be. We need to work on, hey, what's inefficient about how they're moving? And we need to kind of work from both ends of the spectrum, but the nervous system is really the key that connects all of those things.
And you guys have a specialized tool called the ARBWave.
ARBWave is the original,
So,
and then
yeah.
there's a few other clones and things along the way.
So go into that a little bit more.
So stepping back, I was a guy who aspired to be a professional football player. And then as I started to get into later high school, it was like, man, this whole like track and field throwing thing is really my jam because it's so technical. And only the person who's going to put in the time and the reps to really understand and master some of those movements is going to be the one who succeeds, even if you're not the biggest brute in the whole
You had some
competition.
advantages in that category, too.
That was true. But
What did you throw, Tyler? What was your throwing?
Tantrums.
yep. Tantrums. Yeah,
Just
so I
threw
was
down.
shot put, discus, and then at the University of Minnesota, where I ended up added the hammer throw and the weight throw.
Was that your favorite?
My favorite was probably the shot, and then it kind of shifted towards the disc later in college. But
The hammer gets the cool points though, doesn't it?
it's pretty cool.
So cool.
It's very dangerous and very cool.
right.
Violent.
Yeah.
Yes. But so basically, like, I'm like, strength and technique was like my jam. And so coming up through and having the opportunity, studying kinesiology at the University of Minnesota and competing on the Gopher track team, those things, I was orienting myself towards going to physical therapy school, and then got into more and more shadowing and things like that, and just got a little bit less enthusiastic about it because a lot of it was done in larger clinics or like a very insurance dependent model, or people are coming out of surgeries or elderly populations, and sometimes things were not done comprehensively enough to the way that I would want to do it. With
Maybe
somebody.
not specific to the patient.
Yeah,
it's kind
not-
of like a protocol based, like,
Yeah,
this is what
a lot
they
of
do.
what I was seeing.
Insurance is going to cover this. This is what you can do. This is what you cannot do. Like, I feel like that freedom, or
Yeah.
the lack of freedom, is restricting.
And so we were at that. I was at that point, getting towards my senior year of college. Had needed one more internship. My then girlfriend, now wife, was a year ahead of me, working with a hockey organization and their company. So I had stepped in as a director of strength and conditioning, but I was still a college senior, basically. Their company had contracted another company from Arizona called Evo to write all of their training and to implement some of these technologies with their athletes. So essentially, this ARBWave machine, ARBWave basically started as trying to be an alternative to rest, ice, compression, elevation, like injury management, right? How can we do this faster, better, and orient the body itself towards what it's really capable of? Because, like, you need a knee surgery. Rest isn't necessarily the best idea.
Yeah.
Ice isn't necessarily the best idea for a long time. Compression, okay, in and out, whatever. Elevation, okay, in and out. But it's not full spectrum, orienting towards getting somebody back to 100%.
Yeah.
Right? So what ARBWave did was basically, how do we use the body's natural language, electricity, right? How do we use electricity to influence brain muscle behavior? And how can we not just create these like shortening spasm contractions?
Yeah.
How do we create signaling that facilitates tight, spasmed, protective, guarded muscles getting the opportunity to eccentrically lengthen?
And kind of what you're referring to, not just contract, like, for people watching this, would be like an electrical stimulation.
Yes.
Right. Which
Yeah.
everybody kind of knows about. People ask us that all the time. Like, oh, do you guys do electrical stim? And we're like,
Yeah.
here are some other better options, right?
Yeah, because the conventional use of electrical stimulus, like there's a TENS unit, which is, hey, I'm just going to do an electro Advil, right? I'm going to block some pain
Great for
signaling
pain.
in an area,
Yep.
and good, but temporary,
Yep.
right? Or else there's other, interferential and NMES and different applications where you're just working on moving blood flow, getting some drainage of waste and things like that. But it's not really done very much in an active re-education setting, because one cool part about electrical stimulus is you can help recruit muscle fibers, right? So if I flex a muscle, that's me contracting it in a shortening direction. But what happens in the opposite, if I contract my bicep here, my tricep needs to lengthen in proportion to that. And when I have something like an ankle sprain, for instance, my muscles get overlapping contractile signals and lots of things are trying to stay short at the same time.
Yeah.
That's where things like limping and what we call compensation comes from. So to kind of fast forward, hey, what was ARBWave trying to do? They're trying to say, how do we use an external source to get in there and try to speak this same movement language to get things that are shortened up, spasmed up, and retrain the ability for them to lengthen and go back towards normal length and tension relationship.
Yeah.
But just to kind of finish the little how'd you come about story is basically, okay, I had this experience of physical therapy myself. I had a history of shoulder, rotator cuff stuff, and then coming through athletics and coming through all of this physical therapy shadowing, I got a chance through this hockey place to start seeing, oh, hey, wow, I went and worked with this guy who helped develop this technique, and this person walked in hunched over in huge pain in their back, and all of the told some of their story, and none of these people had been able to help them. And they went through this process that looked like very different and actually pretty intense. And that allowed that person to, like, 10 minutes later walk out completely differently than they walked in.
Mm-hmm.
And something with me just said, that is much more of what I believe the body's capable of.
Sure.
You guys see it all the time. You make the right adjustment and the body makes those changes and it adapts, and it can be like a light bulb.
Yeah.
And if people have the expectation of, oh yeah, I had this surgery or whatever it is, and I'm going to be able to go on walks again, but I'm going to give up hiking, or I'm going to give up, a certain level of workout or sport or whatever it is. That doesn't sit well with me.
Right.
I always believe 100% that the human is miraculous. So
Yeah.
so that's the kind of the story. Wow. So ARBWave, doing things differently, but trying to use the body's electrical language to help influence things. No medications, no surgeries, no like major stressful things. You're just
heal from the
using
inside.
signaling to help influence muscle pattern behavior.
Yep.
So,
yeah, which is super cool. Heal
Yeah,
from the inside. I mean,
exactly.
it's a goal. And
what's your side effects? You get tired and increased appetite.
I like both of those.
Sounds
It's
like
like training too.
sounds
It's
like-
like you can be sore. There's some of that. And just
sounds like weed.
I don't know what you're talking about.
CBD.
Oh yes.
What else is out there? Because let's say I'm a really active person and I can compensate and get by, like my 85% is still more than what people are trying to get back to, right? But I have that last 15% I can't figure out how to get back,
Yep.
that type of thing. But I mean, a lot of times too, come in, we'll get people coming in who are 60s, 70s, and most of the things that they try to do to improve might be a little too stressful. Like they start really lifting weights or something like that, and it's just a little too much mechanical force on some of those a little bit compromised joints. Well, we're able to help them find the areas that need more activation and create that opportunity with less mechanical stress, right? So brain muscle stress up, mechanical stress down, work on ranges of motion, and it's a great option for those people too. So
What's fascinating to me, how many people, just at ballpark, are coming in around that 35 to 45, 50-year-old age where, to your point, you're like, I'm 85%, I'm pretty good, right? I can do most of the things I wanted, but like I'm almost 40. And I'm like, God, I could, on Sunday, actually, I'm 39. You're old. 39.
Happy birthday.
Thank you. I just threw it out there. I was fishing for
when's
happy
your birthday?
Sunday,
What date is that?
July 16th.
So you are the same birthday as Wallace.
Yeah.
Yeah, no, we talked about that.
Yeah.
That's right. That's
Happy
right.
birthday, you guys.
Happy birthday, Wallace.
Happy birthday.
You little rascals.
Oh, jeez.
What was I saying?
Your performance, like the last 15%.
Yeah, so I think at my age, I'm just like, well, those days are gone.
They are.
right?
You should retire.
And I was in track and field, and I'm like, God, would I love to just like consistently be able to do some 200-meter and 400-meter sprints? But I'm like, nope, can't do it. Do you see a lot of those people that are in that like 85%? We're like, I can almost get there, but I need you or somebody like you to.
they need that push.
Yeah,
They
right.
need that nudge. Yeah, that's definitely a dynamic. Like I have a guy who first came in because he was doing senior games track and field and tore a hamstring.
Yeah.
Right. And he wants to get back to it because it's like, this is something that brings life to my years, So we want to get that back for people. And, to think that your biological age means you have to like decrease your activity, that's actually completely false.
Right.
You want to maintain a level of health. As you age, you're going to have to increase your level of proactive activity to just maintain what you've already got. People, that's a big misconception.
I need some more whiskey. My cheeks are already buzzing from that little sip I took.
Just a little
There
bit.
you go.
Yeah.
So hot.
Little whiskey tan.
Whiskey tan already. Sorry, guys.
I'll just
Coming off the
flush
top
that
of my
out.
head here. Yeah, just can you filter
Color
that?
correct you out. Yeah.
So for you, like one of the things I wanted to accomplish on the podcast is give people like an idea of like patient walks in, expectations, kind of protocols. Because I mean, for us, like we have an idea, but hearing it from the source is always
Totally. Yeah. I mean, what's our injury?
Those are
side quests. What's your favorite thing to treat?
yeah.
Oh man, I would say just like
You're like, I'm gonna jam this down. It's gonna be
jam
great.
this down is low back.
Low back?
Low back. Oh yeah, all day long. Because there's a bunch of different things it can come from, but a lot of it distills down to the same balance of strength, the same alignment cues, the same postural stuff. And as soon as people do just these simple things, they're like, oh my gosh, this makes such a difference. Because basically it's if I have a really ingrained motor pattern, like that's muscle memory. That's what people think of as a habit, right? Like, you know, so somebody's slices in their golf swing. You can make an immediate change, but that habit is still pretty durable.
I have that problem.
Not anymore.
No.
What's
Did
your
you fix
fix?
them?
I'm not telling you anything, but my lips are sealed.
Your lips are moisturized.
There you go.
If you ever golf with me, I have been putting chapstick on the face of my club so I can it like knuckleballs the ball a little bit.
Let's go while we're young.
You mind, sir, trying to tee off?
I bet you slice into the woods $100.
Gambling is illegal at Bushwood, sir, and I never slice.
Damn! Okay, you can owe me. I owe you nothing.
So my slices.
Sounds like you're cheating.
That's real.
Well, it sounds like it.
I'm
but
cheating.
Like,
Come clean.
It's not a foolproof.
it's like corking a bat.
Yeah.
That's what it
Okay.
sounds
It's not
like. yeah,
cheating unless
yeah.
you get caught.
Yeah.
Little
There you go.
tar on the old ball.
Yeah. I'm wearing a baseball shirt, so that works.
Yeah.
That's funny.
So back to the original quest. Like walk through like patient experience.
Yes.
Client experience.
Okay, so somebody's coming in.
Low back pain.
Well, he was saying knee and shoulder.
Oh, knee and shoulder.
I'd say foot.
Richie, you selfish bastard.
I just want to know what's wrong
Yeah.
with me.
He wants like
Sorry.
a free consult.
Yeah, can we just you guys want to examine
I'll
me on the
be
table?
patient.
Yeah, let's just put Richie's foot on the table.
Let's do this for Richie. Let's
Okay, let's do this for Richie.
All right.
Okay.
No.
For Richie.
So-
For Richie.
It is my birthday.
That's
It
right.
is.
It's a gift to
Oh, you
you.
guys, you don't have to
Sweet.
give me anything.
So
It's okay.
let's say we're running and you've got
Sure.
some foot pain, right? And it's kind of consistent, but there's a little bit of variability there.
He broke his
I
toe
know.
weird. Did you tell him about this?
No.
Yeah, he's got a weird injury in his toe.
What the first thing that we do is we just talk with the person about their issues. What's going on? When do you feel it? What's been the progression? Just get an understanding of that. And then the most important thing, like even if that never happened, is just seeing the person move. So if we need to have that person go run, we can do that. It's a little bit easier to do stuff, in the office. But
He's
I'm
really fast too.
good. It's good. Good. Well, he's nice. But we do a lot of video because and we use some tablet stuff so we can kind of break it down and kind of go frame by frame and look for compensation.
Right.
So it's like, hey, on this, is it right foot or left foot?
Left foot.
Okay, so let's say, hey, when I strike on this right foot, I'm getting this nice push off. I have this gait is just fine, right? But as soon as I hit this left, it's kind of defaulting to the outside. I'm not getting back through my big toe. You can look at the bottoms of your shoes and say, yeah, this wear pattern's a little off. What's going on here, right? And so those are our symptoms.
Right.
But people think that's their problem, right?
Right.
Okay, I have this foot thing, and
Done, let's just
I have
fix
this
it
foot
now.
problem.
Yeah.
I broke my toe. It is what it is, right? Well, actually, when you break your foot or you have to compensate for something like that, your body makes changes all the way up. Like, you can have somebody like, oh, what's going on with my shoulder? But it's like, then we do a couple just basic stability tests, not as in depth as these guys in terms of like kinesio testing. They're better, but just basics to say, do I think this joint is stable enough to influence the neuromuscular firing around it? Because if it's completely flapping in the wind, that needs to be addressed structurally, right?
Yeah.
Or if that anyway, so
Would you categorize like, because I tell patients this, it's like some people need stability, some people need mobility. And that's one of our jobs as chiropractors. Like, do we need to mobilize this joint, or do we need to leave it alone, or like work around it? So that's maybe similar to what you're trying to tease out.
yeah, I mean, I kind of talk about the triangle, right? Strength, stability, mobility, and it's got to grow in every direction. Mobility to a certain point.
What's
that
the
here-
matter
here-
It
with
was
you?
here.
I turned away so I didn't blow your eardrums out.
No, you did
We
a really
appreciate
good
that.
job at that one.
That was a 40-year-old sneeze.
Wait for it.
Any male teacher in middle school just, Sorry, go ahead.
Oh, God.
You guys are over
I like the
top.
triangle.
Triangle.
Yeah,
The
yeah.
expansion.
Strength,
Illuminati.
stability.
Arc reactor.
There you go.
Reactor.
Arc reactor. Flux capacitor. No, flux capacitor.
Damn you, flux capacitor.
Sorry.
So strength, stability, mobility,
Yep.
right? We need to see where things are at and what do we need to influence, because a lot of people will have kind of a flat side of the triangle. So if it checks out as stable enough, then we'll do this process called a neurological search. So we take this stimulus. So think of it like we're saying, the easiest way to understand it is like, it's like a bandwidth test.
Sure.
What's running on 5G, what's running on 4G, 3G, and then like dumpster roaming data,
Yeah.
right?
Dial up.
Yeah.
Dial up, exactly, yeah. But most young people don't understand that.
Cups with a string.
What's that?
Yes.
Your string's loose.
Yeah.
It's real bad.
But so we do this test, and so I'm going to send sort of this test signal through, and you're actually going to feel that as this stimulus, squeeze, pressure sort of feeling.
Yeah.
And that's
And
with
I'm
the
gonna-
ARBWave or Phoenix wave,
Yep,
right?
yep, exactly.
Cool.
So that's going to start right where your pain is, okay? And most people are like, oh man, what's going on? But that area, a lot of times, is completely fine,
Yeah.
right? It's the overworker, not necessarily the underworker or the inhibited area.
That's so cool to know.
So I send that test signal right through there, and then we pass it and map out that whole limb all the way up, wherever we need to go. And we're looking for the areas that, because that intensity of the test signal doesn't change, but your experience of it changes a lot based on if an area is efficient or being inhibited. Whole limb all the way up, wherever we need to go. And we're looking for the areas that, because that intensity of the test signal doesn't change, but your experience of it changes a lot based on if an area is efficient or being inhibited. So I might be really stiff in my calves, but I stimulate the calf and you're like, oh, that feels good, right? But we get to like your gracilis or something like that, and if your muscle up here has not been firing well and your body's avoiding it, and that's part of this whole like twist you do to get to the outside of your foot or something like that, that will come up as, ooh, what is that? Yuck, right? And you'll see the same type of compensation that you see when they move. Like this baseball kid, when he would throw, he would hike that shoulder up massively. And so as soon as I hit the area that actually is a real dysfunction instead of an overcompensation, I would see, ooh, that same type of guardedness. So we go through that little mapping process. You usually find at least 2 spots that are influencing that foot issue, or like keeping it, the brain's priority is keeping these areas dialed back,
Right.
not in allowing everything to go back to how it's designed. The body's great at compensating to get us by and let us survive and limp along, but it's not as good unless we really hyper intentionally train it back. So that helps us figure out, okay, yep, I think your foot pain is coming from this lingering dysfunction in like your soleus and your groin. Okay, so now we're going to work those areas with this stimulus to help say to your nervous system, these areas are moving at velocity. They're getting lots and lots of information, lots of feedback. There's a lot of speed going on there. Okay, so right off the bat, that might feel guarded and weird and intense. But if it's for you, yeah, it hurts every time I go up on my toes or something like that. I need to have you probably do that motion if there's nothing wrong with it. Like I'm not gonna have you bend and twist and lift heavy things at the same time.
Right.
But if we're doing something that makes sense, like rise up on your toes and go up under your heels, something like that, I need to get your brain back in the context of what it hasn't been doing right.
Right.
Now it's got this new piece of information to help reintegrate those muscles back into what ought to have been happening. And by the time we do a few rounds where we take it up to bring out the guardedness, work it down, take it up some more, work it down, you're reconditioning those areas to deal with stress again. And now, bing, bang, boom, 7 minutes later, something like that, we'll take you all off and we're going to retest those movements. A lot of people will see at least 50% pain reduction, like right off the bat, like 7 minutes later. Sometimes even more, sometimes a little bit less. We look for at least 25-30% minimum to be confident that we can help that person. But they go through that. Okay, what might come out of that? You'll probably have some of the symptoms return a little bit because you've had, how long have you had the issue?
15 years.
Okay, so I mean, like 15 years versus 7 minutes. You know, I'm not a wizard.
One
or
visit's
anything
going to
like
fix it, right?
Guaranteed.
Yeah.
Well, the cool part is if I can see, so I look for 3 main things in an eval. 1, do we have clear search locations? Like your body told us this was not cool, right?
Yeah, sure.
If that's clear, that's a good thing for me, right? And then number 2 is when we're doing our work, if we can take something that is guarded and move through and get it to be much more tolerant, that's a really good thing too. It's showing us that adaptability potential. And then number 3 is symptom change. Hey, actually, he was able to go up on his feet, and instead of this left foot toeing out, he was actually able to stay straight. Or he went, he went 20 degrees higher or something like that. We would want to see a change in those symptoms right off the bat.
Yeah.
If I see those things, then that's a definitely green light.
It's like a pain guide, like a spirit guide, but for pain.
Oh,
your
yeah.
path is towards your pain, but you need somebody to guide you to do it correctly.
Well, you'll get some guardedness, right? But then your body is getting this whole new set of information that it's, optimally designed to be able to handle, right? So as you start moving and adapting and changing, we'll see that guardedness go away. So it's not something that's like, here, bite down on this,
And that's probably where the majority of people get the soreness and fatigue afterwards. Because it's like,
think of it like you've got a muscle that's been sitting up in the attic for a long time,
Get down here.
we're bringing it down, we're dusting it off,
Skeletons
we're
and
getting it back in here, and that's got to adapt, and it's going to have some soreness and things like that. But it's typically not the, ooh, I just abused that soreness. It's more the, wow, that felt like a workout.
Yep. I definitely needed a change of clothes after our session.
That's true.
I was sweating. It was good though. I mean, like honestly, I tell people it was one of the only things that moved my knee pain away.
That's great.
So. So part of being a chiropractor or clinician in any type of field is like, okay, patient, we're doing this. This is a new habit for you in clinic, like we're adjusting you, but like you have to do some work as well. So in your paradigm and your sector of the world, what things do you usually tell patients, or like what can you tell our audience, all 60 of them?
68,
69.
I counted this morning.
68.
It's actually
nope,
like
69.
37.
Did you subscribe?
Is it really 69?
Not yet.
Yeah,
I
well,
didn't.
He will be our
like that.
69th.
I will be there.
Yeah.
All right.
Like when you're working with people, what are some like high points that you tell people?
Yeah.
Like empowerment strategies.
Well, usually it starts with, their understanding where their issue is coming from. So here are some more actual bang for your buck strategies to keep it that way. Like a lot of times it'll start with body alignment and postural stuff. Or if they don't understand, here's like some breathing. Like here's how we can affect just super basics. And I don't like to give people a ton of homework right off the bat outside of alignment. But once they start to see how that affects, this is another cool thing. When you're on that machine, if you're out of alignment, it feels way worse than if you're in good alignment. And that's a very validating thing for like, oh, I get this. This makes sense. My body's designed to stay this way and support me this way. So just instilling the basics and the urgency of, here's what happens when we don't use our bodies the way they're designed to be used. And then progressing people forward, because I don't ever, well, I shouldn't say ever. Like I very rarely see somebody beyond an initial intensive plan. Right? They might do some check-ins and here and there and whatever, but my goal is to equip somebody to keep doing these positive habits and to have made enough of a change and ingrained enough of that change to stay that way long term. So like, oh yeah, I used to have this foot thing, but then we did all this work and I had to really strengthen up my hamstrings because this, and whatever it was. And now I just keep doing these fundamental things. Like I integrate it into what I'm already doing, or I've got a little morning routine or whatever it is, and just empower the reason why we do these simple fundamental things. But usually it's not anything outside of just understanding the actual urgency to not slouch or allow yourself to do some of these normal compensations. So once people get that, they feel very empowered because now they understand this is where my issue came from. This is what I did to fix it. This is what I can keep doing to keep it away. And that's great. Like we've had people in horrible pain, All right, tell a quick story. That's cool.
Yeah.
It's your time.
It is your time.
So I had a guy, Army vet, Afghanistan, had a guy fall from a second story on top of him. Spine like severely compacted, enough adrenaline being overseas, and by the time he got home was when it really started kicking in. So it goes through physical therapy and acupuncture and chiropractic and a lot of the conventional means, and he was like too guarded for a lot of those things to get in there, right? And so the main thing that ended up creating some relief for him was Oxycontin. And over the, I don't know, I'm not a pharmacist, I'm not the person, but when my girlfriend, now wife, had torn her ACL, they gave her 10 whatever units of Oxycontin to have at a couple times a day. This guy was doing 180 units every single day just to get by.
Yeah.
Right. So this was ridiculous. And this is year 6 of him coming home, and he's just a shell of a guy. Like he used to be like 250 pounds and really muscular and whatever. He's sitting on the bench, like a shell of a guy. We did our eval, we did the work, and figured out that most of his intensive avoidance was in these adductors, these inner thighs. And just for him to stand and try to march in place would kill his back, right? So on that first day, he was able to stand and march in place, right?
Wow.
So that was cool. But you fast forward, within 2 weeks, he was able to touch his toes again. Hadn't done that in 6 years. Within 30 days, he was completely off meds. Within, what was it? Probably right around that 30-day mark, we were back to deadlifts again, like weightlifting.
Jeez,
and
awesome.
so this guy, he's got young kids, he's, I don't know, maybe a year or two older than me. He's got young kids, and he's back to feeling like himself again. So what's the empowerment strategy there? It's like, I don't want to go back to where I was. And these are these simple little things that we just ingrained and implemented. It's like, yeah, you can't allow yourself, because one of his big things, he's got a very physical job, being outside a lot, wherever he would just stand to the outsides of his feet and kind of roll in, just talking with people. And that was kind of his normal posture. And he just had to break that. And keeping with that, doing a morning routine, continuing with strength work, I haven't worked with him intensely in probably, 3.5 years.
That's good.
And he's still doing awesome. Even though he still has a jacked up back, right? But it doesn't experience the symptoms of it because his body's adapted to use everything the way it's designed, and you don't get the breakdown.
Wow, so such a cool story. I mean,
yeah, man.
Just saving lives, Think if that progresses another 6 years.
No kidding. Wouldn't be
Like,
hard to be around.
That's crazy. I mean,
Good job,
that's why
man.
we're all in those stories like that just
Oh gosh,
keep in the back of your head.
That's amazing. Yeah,
That's super cool.
All glory to God, but like it's fun to play a part. So
Oh, yeah.
Yeah, we're
seriously.
just a vessel.
Yeah.
Cool, man.
It's great.
Well, that's a great end.
Yeah, let's all shut
Man,
up now.
let's all shut up. And well, thanks again for coming
Thank
in.
you
and,
guys. I really appreciate you.
There's definitely going to be a episode 2. We'll have to talk about some other.
Yeah, we'll get
other
into
things.
the rest of life, and
Yeah.
we'll talk about shoulder things.
We can talk about shoulder things. I want to talk about fatherhood.
Yes.
That would be fun.
Yes. So.
Well, you have to stay strong if you have kids, because they're going to
You
come
do.
at you.
What more motivation do you need?
Yeah.
Seriously.
They're all violent. They just want to be on top. That's all
Yeah.
it is.
That's right. You gotta be ready.
Cool.
But yeah, we'll talk again. Otherwise, it's a wrap.
On the tap.
On the tap.
It's the house of learning doctors. You're not a doctor.